Good morning and welcome to the Senior Hour, which is sponsored by Comfort Keepers in Home Care, Santa Clarita Hearing Center, and Traditions Healthcare. I'm Barbara Cochran with my co-host,
Dr. Jean Dorio.
On your hometown station, 98.1 FM, AM 1220 KHTS. This is a show for, about, and by seniors, giving information to enhance one's quality of life. And speaking of quality of life, our guest this morning is Dr. Marwa Kilani, a palliative care doctor. Good morning. It's good to see you again.
Oh my goodness, it's so great to be
It
here.
seems
Welcome,
like it's been
Paula.
Hi,
months.
Jean.
Welcome.
Yeah, it's great to
Hi.
be here.
But
Okay.
now you're in the studio, aren't you,
Yes, I'm in
Paula?
the studio. I know that Barb was vaccinated and I'm vaccinated, so I feel quite
Yep.
confident being here with her.
Cool.
And I feel this renewed sense of uh, freedom. Um,
Isn't that so?
yeah. It's pretty rare for me to get out of my confinements, either at work or in the home. And now that I've gotten my vaccine, I do feel quite free. I feel regenerated,
I agree
Yeah.
with you completely.
rejuvenated entirely.
Yeah, because the only places I would go was here
Yeah.
or to a doctor's office.
Correct.
If he or she even had them come in. One of my doctors does nothing but call me.
Yeah.
And to me,
It's just not the same.
no, it isn't. I would rather be there and talk with him person to person. It makes more sense to me. But anyway, that's
And I
why.
think more trust, Barbara, will come with what's going on, I believe. So not that things are ever going to be back to normal. And I think they'll be close, but there always will be some hesitancy because, right now the virus is out there.
Still
And only
is.
31% of the Santa Clarita population has received their vaccination.
31%?
31%.
That's all?
Yeah, and in
And they
LA
must be
County,
all seniors.
well, there's a large part of that. Correct. 34% in of the seniors in LA County have received their inoculations, and 65 or older, and only 11% of those 80 and over. So there's still quite a few people who have not been vaccinated, and there's still, I see it every day, and it's in the journals and the blogs about those who don't believe in vaccinations. So, I believe in vaccinations, and obviously Dr. Kalani believes in it, and both of you in the studio, and it's one of these things where science and the message that is being given out there needs to be clarified for some, and we're trying to do that now. And I just want to say one important thing, that I got my first injection and then second injection. Before my first injection, I had no antibodies. I got a blood test.
Me too.
And I had no antibodies. Even though I was seeing patients with COVID, I still did not get the illness itself. I got the injection. After the second injection, 2 weeks after that, I tested my antibodies in my blood, and I was loaded with them. And I had not had any symptoms, so I know I wasn't infected. But I got the vaccination, and it did work. So, the public has to understand that the vaccination is out there to help people. It's not a conspiracy. It's not to infiltrate your DNA or anything like that. It's to protect. And that's what it's doing. And I think that's why both of you are there in the studio feeling comfortable now and more confident that we can live life again. And pretty soon, Barb, you'll be going back in to see your doctor.
Well, I sure hope so. I'm supposed to have an appointment with him next week, so we'll see what happens.
See what happens. Exactly.
Yes,
But
absolutely.
anyway, the other problem, too, with a lot of people, and me to begin with, you can't get an appointment. You make those calls to the number that they give you, and they put you on hold. They put you on hold And finally, after 10 minutes of being on hold, I said, forget it. And my son who lives in Palmdale, one of his employees she persevered because Scott said, Mother, you're not going out until you get your vaccination.
Correct.
Yeah.
Absolutely not. Not because of your age, you cannot take that risk.
Yeah.
And he was right, but she got me that first appointment. She persevered, and I went to Magic Mountain, got in the car, and
Yes.
went all up and down those little.
Cones.
It was fun. It was fun. It really was, because I was playing a game on my cell phone, and I was listening to the radio, and I'm thinking, wow, this is kind of nice. Not doing anything.
Yes.
And that's rare.
Yes. Well, I gotta say, the contrary to getting vaccinated is just not an option, from what I see within the hospital setting. The vaccination is very much an enhancer of quality of life from my perspective. And I think that it is a necessity. And I can't wait to get my children vaccinated. They're in that
Yes.
age group 12 to 15 that is currently being studied. So I'm ready for them to move forward with that as well.
Yeah, my daughter now and my son now are qualified because they're
Yes.
60.
Oh, yes, yes.
And
So as of April 1st, 50 and over can stand in line without any
Right.
comorbidities or, any hesitation, and it's available. And
That's right.
soon, April 15th, from what I understand, in the state of California, all adults 16 and over will be eligible.
Terrific.
Right.
Now all they have to do is get an appointment.
Just get an appointment. That's the
But it's
kicker.
amazing to me why all of the doctors' offices don't get a supply of the shots. Maybe because
don't.
there aren't enough around. But doctors' offices,
that's
in
it.
my opinion, should be getting the shots to give their patients.
I think it depends on the shot because of the refrigeration component
Oh, that's
of
right.
the Pfizer vaccine. But, the Johnson & Johnson being a one-shot and easily distributable could be something that could land in physician offices very, very simply.
I would think they would.
And you guys know that I do house calls, and that there's some of my patients who are bedridden, and we
Yes.
still have not figured out a way to get them their shots. Now, there are some of my patients who get admitted, those patients, and on discharge from the hospital, they come in not having COVID. They have something else going on. One of my patients just had his gallbladder taken out at the age of 90.
Oh, God.
Whoa.
But he did well.
Good.
But he did not get his vaccination. And what we're trying to do right now is get a ruling from public health to allow hospitals to give the Johnson & Johnson vaccination on discharge from the hospital.
That would be fabulous.
But, it's got to be a ruling that I believe comes from LA County Public Health to be able to allow hospitals to do that. And there's quite a handful of individuals that are susceptible and vulnerable who really need that shot on discharge, but they're not getting it because of the what Marwa, you said, the problem with having it in a doctor's office, or for me carrying it on a house call is, I would have to have the Johnson & Johnson one because you don't have to freeze it.
Right.
Whereas the other two, Pfizer or Moderna, have to be at a very low ice, ice down, dry ice sometimes level of cold, or else it disrupts the mRNA. So, we need to figure this out because I know the Board of Supervisors was very upset about hearing only 34% of the senior population in LA County has received their vaccination. That's last week's data, but, that's not, to me, acceptable at all. So we need to do better. And, many of our patients and family members are coming up with these ideas, and we can present them to the appropriate people that will get the ball rolling on this. But it's got to be a loud voice to be able to do that.
Yes, yes, it does. Now, let's get back to business here.
Hmm.
Our guest, Dr. Marwa Kilani, you are a palliative care doctor. Now, what is palliative care?
Well, palliative care provides specialty level of treatment for patients who have serious illness. It is team based. It is a focus on quality of life. So, what elements of quality can be enhanced in a patient with serious illness are things such as their pain and symptom management, their social dynamics, their emotional health, and spiritual health. So we try to focus on our patients who have serious illness as individuals. So we see them beyond their illness and want to focus on who they are as individuals and try to provide them whole person care.
Now, does that mean going to their homes?
Yes, we do have community-based programs, and I mean, I'll tell you, I think that Dr. Dorio in his practice, he's doing, as a one-person entity for the most part, is doing a pretty tremendous job in trying to enhance the quality of life of his
So
patients.
he does
He is
palliative care then.
he's palliating. He is. Should I characterize that correctly, Dr. Dorio?
Oh, absolutely. I mean, I
Yes.
do palliative and have provided hospice
Yeah.
care for my patients. I bring in hospice groups in to help my patients out at end of life.
Yes.
This is quality of life
Yes.
for our older adults. So yes, it's definitely necessary and needs to be better understood by the public in how we handle these situations as they come up. And I really want to know, Mawa, when there's been a tremendous impact of this pandemic on your field.
Yeah.
And it's really in terms of discussing this with our audience, our listening audience, how we are affected now and have been affected by this virus has made many changes. But in terms of medicine, yes, telemedicine, like Barb was saying earlier, but palliative care has really had to be out there and doing their job and enhancing the education level of the public. So how just the question is, how has that impacted your field and yourself?
It has impacted us tremendously. I can tell you that we not only have to really stick to our concept of that serious illness. Serious illness doesn't necessarily mean they have a terminal cancer. In the scenario of COVID, we were seeing patients as young as in their 30s and 40s with very serious COVID-19 complications. And it was a serious illness, and those patients and their families needed to be supported. So it was very much out of our routine, in a sense, where we were dealing with more routine things such as COPD, patients who have heart failure, patients who have the end effects of dementia, or different types of advanced cancers. Well, palliative care was really thrown into a different realm with COVID-19 and this pandemic. And we were not only seeing patients with severe COVID-19 complications, but we were also introduced to patients who were otherwise fairly relatively healthy individuals, but who had been afflicted with COVID-19 and were in, requiring high demands of oxygen support and having to have very serious conversations with them about their future healthcare goals. So we were really in a position to help support the public, help support the patients and their families. It was a tremendous year. I got to tell you, I am not looking forward to any future surges. So I am out there on a one-person campaign to see how many people can be vaccinated.
Hmm.
So, because these last few months were probably the worst I've ever seen in my life. I mean, I've been a physician since 2000, and it is unbelievable what we've seen in the hospital setting. Unreal.
And we have to give kudos. We just have to give the recognition to Providence Holy Cross, Henry Mayo Hospital, all the way down into the valley in our whole area for all the things, the first responders, the nurses, the doctors. Yesterday was Doctors' Day. Congratulations, Dr. Kilani.
You as well, Dr. Dorio.
Thank you. And, you know, honestly, they've been those frontliners under tremendous stress. And I'm sure you have too. And it's not been easy. I see some of my colleagues on the East Coast who have suffered PTSD from what they've done. So I honor all of them for their endeavors and not giving up and helping patients out and bringing them the quality of life that sometimes end of life that they needed in a circumstance when their family was not around or not allowed to be around in their care. So it's been tremendously tough. And you know, if you look at some of people walking through now the mall or grocery store and you see kind of reddening on their face, bow to them, thank them, because you know they've been wearing their masks and struggling to save people's lives, and we have to honor them for that.
Yeah, I do. I do commend all my colleagues and all of the frontline folks and essential workers that have really persevered this last year.
Absolutely.
It really has taught me a lot about humanity and the importance of community. And it was at times very dark, and very dark days, but at the same time, it was a loving experience. I don't hope to replicate it though, so I'm happy where things are at. I can tell you that at Holy Cross, we have just reopened our visitation for our patients, COVID and non-COVID patients. So they can actually get visitors, 2 visitors within the hours of 11 and 5 o'clock p.m. every day.
That's great.
It is a blessing.
What a relief.
It is just
those patients.
I would see visitors come into the hospital and I almost would grab them and just hug them. I mean, it was just such excitement to see them. It really does bring tears to my eyes thinking about it.
And it brings such happiness to the patient plus their visitor.
Yes.
You know, because that distance that they've been kept apart for who knows how long in some instances.
Yes.
I mean, that must have been devastating.
If they were coming from a nursing home, they probably hadn't seen their loved one in months.
It's just, it's so sad.
So this past week has been quite pleasurable. So we're quite grateful.
Well, let's hope that we are on our way out and things will get back to normal. Maybe a new normal, but more normal.
I'll take new normal.
New normal anytime. And I think we need to take a break, don't we? I'm Barbara Cochran with my co-host, Dr. Jean Dorio, on your hometown station, 98.1 FM, AM 1220 KHTS.
Your business sign is essential to getting customers to your location. Feathers can help you get your business noticed. Feathers, now in a new larger space with plenty of parking. They walk you through each phase of your project with special attention to detail and quality. Feathers will provide you a sign that you can be proud of. Your sign will draw customers in instead of having them drive by. Visit Feathers online at feathersigns.com or go to Feathers' brand new bigger location at 26017 Huntington Drive off Rye Canyon or call 298-9442.
Olive Terrace Bar and Grill is the hottest new Mediterranean fusion restaurant in Santa Clarita with unique delicacies like seafood right off the boat, mouth-watering prime steaks, artesian sandwiches, delicious pastas, and tasty kebabs. Unwind on their cozy outdoor patio at their weekend champagne brunch, full menu, and weekly specials at oliveterracebarandgrill.com. Check out their full bar and happy hour daily specials in Valencia on Copper Hill and Newhall Ranch Road by LA Fitness. Olive Terrace Bar and Grill, delicious food seasoned with love.
Consumers Furniture is back open for your business. The safety of our community and our staff, above all, is most important to us. We will provide a safe and clean environment for you to find the perfect piece of furniture for your home. To help you with your purchase, we are offering 25% off your entire order or 24 months same as cash financing. And for our awesome essential workers, we will deliver locally your furniture free of charge. Consumers Furniture is located in the Center Point Shopping Center below Sam's Club and Walmart.
Loss of hearing can affect the quality of life. Santa Clarita Hearing Center can help. They specialize in both preventative hearing loss and corrective measures, including diagnostic tests, new technology hearing aids, cochlear implants, hearing protection, and tinnitus treatment. They can adjust your current hearing aids or fit you for new ones. Santa Clarita Hearing Center also offers sleep molds, swim molds, and musician monitors. Book an appointment today. Log on to SantaClaritaHearingCenter.com, located on McBean Parkway next to the hospital. That's SantaClaritaHearingCenter.com.
If you're in need of physical therapy, check out Focus Physical Therapy. Owner and therapist Adam Laraway has the latest in cutting-edge technology, introducing the Newbie, the ultimate in neuromuscular re-education. The Newbie can help you heal up to 70% faster and was FDA cleared in September 2017. The Newbie uses pulse direct current, which mimics the same neurological signals the brain uses and allows the therapist to identify those signals with 100% accuracy. Newbie can even help improve your sleep while tackling issues with neck, knee, and shoulder pain, sciatica, and arthritis. It can accelerate your fitness progress, which means better results in less sessions. Get stronger quicker. Why not use the same technology that the Dodgers and the LA Clippers use? Focus PT, located on Peachland off Lyons in Newhall. Call 255-4205. Go online at focusphysicaltherapyscv.com.
Your hometown station.
Will you still need me? Will you still feed me when I'm 64?
Welcome back to the Senior Hour. I'm Barbara Cochran with my co-host, Dr. Jean Dorio, on your hometown station, 98.1 FM, AM 1220 KHTS. And our guest this morning is Dr. Marwa Kilani, a palliative care doctor. And we're laughing over something that we were discussing during the break.
Oh, dear.
I don't know about you, Dr. Dorio. Sometimes I wonder.
Bringing it to the subject of Dr. Kilani and what she does, it's so important that when you have to have your paperwork in place. Many patients who did contract this virus did not have their power of attorney in place, their advance directive in place. And so it's so important that the legal paperwork is set out there and made sure that people know exactly what your wishes are should the extremes of your health care be in doubt or in jeopardy. So that I think it's important we clarify for our listening public to make sure they do that, so doctors aren't faced with difficult decisions.
I absolutely agree. I think it makes the process so much simpler for everybody within the healthcare system. If a patient has their advance directive in place, and it's a gift back to your family as well, giving them the clarity as to how best to proceed, who's really assigned to make decisions, and what are those decisions that your family members or your surrogate is to uphold. Yeah, it's critical.
It is. And when Russ and I had our trusts done, we made sure that the advance directive was in there. And I was asked if Russ had one, and I went right to that trust packet, and there it was.
Yep.
Right there.
Yeah.
And I think it's extremely important. It really is.
And the selection
But you
of
have
the
to
person.
have
Yeah. Go ahead, Gene.
you have to have a discussion, though, and there's a fear of having a discussion about what do you want, Mom, Dad, what do you want should something happen to you? And, it goes to not just health care, but arrangement with finances, funeral arrangement, so many other distribution of property. So many of these things occur, and we don't talk about it until it's almost too late. So these discussions have to happen and come forward right away. So not an easy discussion, but it's like, our when we do the birds and the bees, our sexuality,
Well,
that's a tough discussion with your kids.
Oh, it
Now
is.
you have to have a tough discussion with your parents. And so it's not easy.
No, well, I had this discussion with both of my kids, and they were, Mom, what are you talking about? You're not going to leave anytime soon.
Is that the birds and
And
the bees? Or is that...
it's interesting because you never know. You
Yeah.
absolutely
That's
never know.
And
I mean, I decided many years ago to purchase long-term care insurance.
Smart.
And Russ was dead set against it. I did it anyway, and I didn't tell him until he needed it. And I finally told him, I said, many years ago we discussed you said not get it. I went ahead and got it anyway. And it saved us.
It
I mean,
did.
we would have gone through so much of our investment and our savings, but that long-term care insurance paid for 2/3 of his bill. And
Wow,
he had
that's great.
24/7 care.
Wow.
And from 10 at night to 6 in the morning, that is not cheap.
No.
Believe
no,
me,
no, no.
it is not cheap. And of course, you can't blame people. They have to earn a living, and they're taking up their night to take care of your loved one, but it's worth it. And I'm so thankful I did. And Russ had to agree with me finally. He said, yep, he said, you did the right thing. He said, as much as I hate to say that, you did the right thing. But that was Russ. He was, he was a comic. He really was.
Yeah,
In a very, very, very different way.
Yeah, he had a great perspective. I know early on my parents had introduced that concept of you need to always be prepared. And this was one element that they always prepared me on since I was a little girl. This is who you rely on if something happens to us. That this is this account, this is our trust. That they had everything lined up. And back then I had no idea, but now that I'm older and I appreciate it, and I'm closer to 50 than I am 40 these days, I can absolutely understand. And now that I have children of my own, we're doing the same thing with our children, is setting them up for success and making sure that they have all the power, all the means to take care of us as their parents, and also make the right decisions. And I have to say, like I said, it is a gift. It's also a matter of respect and honoring the people that you love.
That's very true. And I think my father instilled that in me. And I think going through the war years in the Second World War, when I was a little girl, and I went through it, I mean, literally scared to death. But my father always said, we have to be prepared. And I mean, he was gone for many, many years during the war, and I never saw him. In fact, I was always waving goodbye to him. And but he always stressed that, insisted upon it. Be prepared. Look ahead.
Yeah. I think our version of being prepared was stockpiling toilet paper and paper towels. But I think that we could do some better. I think we could do better. And I would highly encourage our Santa Clarita folks to really buckle down, pull up a free advanced care directive that's posted on the website and complete it, get 2 witnesses, and give it to your doctor so that we all have it.
Absolutely. I think it's critical. And if you can get long-term care insurance, please do, because you will not regret it. And I've even had all of our funeral arrangements taken
Yes.
care of. That's all
Smart.
paid for. And, it's only the miscellaneous things that come up that you have to pay for. But I'm so glad that I went ahead and did that because it saved thousands and thousands of money.
absolutely.
It really did. Really did.
Yep.
And I know that it's something that my kids will appreciate. When I'm
So one of
gone, they won't have to worry.
You've given them a gift back.
Yes,
That's right.
that's right. And they keep giving to me. Thank goodness they do.
Yeah.
Because I don't like
So
being alone all the time. And when they come down,
Oh.
whoopee!
Yeah, that's beautiful.
And my son says, Mom, he says, get an Uber. Come up and see us. Because I don't like driving all the way. It's not far.
No.
But, I'm moving toward 90. And I don't like being on the road.
Yeah.
Not when I have to do that. And if I want to have a glass of wine for dinner, I'm not going to drive back home.
No.
No way
No
at all.
way. Mm-mm.
No. So I either get an Uber, which my daughter does not care for because you're with someone who's a complete stranger. You don't know where he's been, what he's done, or anything. And otherwise, I try to get my grandson to drive down and bring me back home, and I pay him. I'd rather pay him than pay an Uber guy. But no, I'm not on the streets in the car very much, not anymore, not at my age, because I know I forget things and I lose my concentration. I mean, I'll go from one room to the other and think, what did I come here for? And my son said, Mom, you're not sweet 16 anymore. You have to stop and think about that. You're getting older. I said, I'm glad you said older because I'm not getting old.
No.
I said, I'm getting older.
There you
But
go.
that's very true. The mind has a tendency to go somewhere else when you don't want it to as you get older.
Oh, yeah.
So
Right.
I know you realize that, and you do too, Dr. Dorio, because of some of the patients you
Yeah.
have go through the same
Yeah.
thing.
Absolutely.
And as we get older, things kind of sort of slip away a little bit.
Little bit, no doubt. But one of the topics that we probably should discuss with Dr. Kilani is hospice and hospice care, because that's when I realize sometimes that there's nothing else as a 2021 physician, trained physician, that I could do for my I can't do anything more for my patients. Sometimes my patients will even say to me, Dr. Doria, I've lived a good life, but it's time. This is my time now, and I prefer to, have a good end to this and be comfortable and be with my family, and we do that. But it's not a easy discussion as well. But this is let's talk a little bit about Dr. Kilani, the role that you play in hospice and hospice care.
Absolutely. I think as a palliative care provider, all palliative care providers are also certified to provide hospice care, though some may specialize in hospice and some may specialize in palliative. My role within Holy Cross is a palliative care physician. So I take the full spectrum of serious illness. And when it comes to the point of needing end-of-life care and hospice care, it's something that we can discuss, advise, and help our patients transition to that point. I'll give you a really clear example of a case. I have actually a very dear friend of ours who we've known for several years. And their father has been declining. He's been declining over the past few years, has been living at an assisted living, but he is living quite well. He's got a caregiver. He goes out a lot. He gets to travel still. He goes up to his winter home, and he has a beachside property as well. I mean, he lives well.
Wonderful.
And beautifully. But yeah, he's starting to get confined to a wheelchair. He's slowing down. He gets short of breath. His appetite is going. And when is that right time to consider hospice? And we talked about it, and he says, I still feel I have time. And even though I'm carrying very serious illnesses, I still want to pursue treatment. I want to go to the hospital if I need to. That to me is the very basis as to where the discussion needs to happen. If a patient is saying, I just don't want to go to the hospital anymore, that's probably a good transition point to say, okay, well, let's redefine the type of treatment and care you'd like. And that could be the point where you can transition a patient into hospice. But, it's a very, very serious conversation. It needs to come from somebody who is very skilled in that conversation and who knows the patient really well, has been able to sit with them and really get to know them.
And that's why sometimes I think we need to move into a different arena, as we've been pushing too many of our patients into nursing homes.
Yeah.
And because we have, now those who are vulnerable got COVID and some passed away, our society in doing that belittled what we have tried to achieve in medicine to help those who can be helped and then to help those who are at end of life. So it's been difficult recognizing the problems that we have faced with this pandemic, but now it's time to really assess and say, okay, my life is good and I want to keep going, or it comes toward the end of life. But when you know the patient well enough, and for instance, if doctors or nurse practitioners or physician assistants go to homes and do house calls, that could be of great benefit, and of course knowing the patient better.
Absolutely.
And I will tell you, there's just not too many instances where I'm surprised where a patient says to me out of nowhere, I want to be on hospice. I already know. They know too.
Yes, they
because
do.
the discussion has been made with them, and that's what we need to start doing more in our society and more medically. So having a medical professional, such as a doctor or nurse practitioner or PA, who does house calls, will make a large and big and huge and monumental effect on a person's life and end of life. And we need to be doing more of that, but we're still in the infancy of trying to do it.
I know, and we need to take a break. I'm Barbara Cochran with my co-host, Dr. Jean Dorio, on your hometown station, 98.1 FM, AM 1220, KHTS.
When a person is diagnosed with a life-limiting illness, the patient and family may become overwhelmed with planning, emotions, questions, and fear. The Traditions Health Hour provides information and guidance to help them navigate through their end-of-life journey. Their goal is to help patients have the best quality of life possible while receiving the care they need in the place they want to be, home. Get your questions answered during the Traditions Health Hour, Wednesdays at noon, right here on KHTS, and live on Facebook at KHTS Radio.
The city is opening up, and so is Coyote Creek Locations, right here in Santa Clarita Valley, ranch-style open landscape for you to create your next perfect event. Weddings, graduation parties, bar and bat mitzvahs, baby showers, and birthdays. Any sort of get-together where you can spread your wings and breathe in fresh air, creating memories with friends and family while supporting healthy space and distancing. Spring is here, and summer is coming, so get ready for your next celebration at Coyote Creek. Book now at coyotecreeklocations.com. That's coyotecreeklocations.com.
The anticipation of having a baby brings much excitement and hundreds of decisions. When choosing where to have your baby, choose the best. Providence St. Joseph Medical Center. The new Women's Pavilion combines expertly trained medical staff with luxurious labor and delivery suites and the area's most advanced neonatal intensive care unit. You and your new baby will get the best start possible. For more information and a tour, call 1-888-HEALING. The road to healing leads to Providence.
Loss of hearing can affect the quality of life. Santa Clarita Hearing Center can help. They specialize in both preventative hearing loss and corrective measures, including diagnostic tests, new technology hearing aids, cochlear implants, hearing protection, and tinnitus treatment. They can adjust your current hearing aids or fit you for new ones. Santa Clarita Hearing Center also offers sleep molds, swim molds, and musician monitors. Book an appointment today. Log on to SantaClaritaHearingCenter.com, located on McBean Parkway next to the hospital. That's SantaClaritaHearingCenter.com.
If you're in need of physical therapy, check out Focus Physical Therapy. Owner and therapist Adam Laraway has the latest in cutting-edge technology, introducing the Newbie, the ultimate in neuromuscular re-education. The Newbie can help you heal up to 70% faster and was FDA cleared in September 2017. The Newbie uses pulse direct current, which mimics the same neurological signals the brain uses and allows the therapist to identify those signals with 100% accuracy. Newbie can even help improve your sleep while tackling issues with neck, knee, and shoulder pain, sciatica, and arthritis. It can accelerate your fitness progress, which means better results in less sessions. Get stronger quicker. Why not use the same technology that the Dodgers and the LA Clippers use? Focus PT, located on Peachland off Lyons in Newhall. Call 255-4205. Go online at focusphysicaltherapyscv.com.
It's like no other station I've ever listened to. It's great.
Your hometown station.
Will you still need me? Will you still feed me when I'm 64?
Welcome back to the Senior Hour. I'm Barbara Cochran with my co-host, Dr. Jean Dorio, on your hometown station, 98.1 FM, AM 1220, KHTS. And we're speaking with Dr. Marwa Kilani, who's a palliative care doctor. And we have covered a multitude of areas today.
Yes.
My goodness.
Yes,
it's
we
been
have.
nonstop chatter, but it's all been good. It's been very informative. And, speaking about palliative care and all that kind of stuff, when Russ was admitted to the hospital, and you remember that, Dr. Dorio, he did not want to go.
Yes.
I had to call 911 for them to come and get him and take him because he was not going. There was no way I could get him out of that chair and get him into the car and take him in. And he absolutely refused. And while he was in there, I finally had him put on palliative care. But the doctor in the meantime said, he's been here X number of weeks. Let's put him in a nursing home. And I said, absolutely not.
Mm-mm.
And Russ had told me, he said, that's the last place I want to go.
I know.
And
I know.
I said to
Yeah.
the doctor, I can't take him home
Yeah.
because he needs a hospital bed. He needs intravenous stuff and all the things that happen as you get closer to the end of life.
Yeah.
And I said, no. I said, I don't care what it takes. He's staying here where he will be taken care of. And taken care of well.
Yeah.
And Henry Mayo did a marvelous job of taking care of him. They really did.
I'm glad
And,
they did. I'm glad they did.
It was a blessing. It really was. And it was a big relief to me that I was able to keep him there. Because having him come home, it would have been a nightmare for all of us. For him, for me, and for the person who was there.
Yeah, it would have been challenging. It would have been challenging.
I know it would have.
I know we probably could have done it, but it would have been challenging. Right.
Yeah.
But I think that was the best plan.
He was better. Don't you agree, Dr. Dorio?
Oh,
he
yeah.
was better
Oh,
at
yeah,
the
and
hospital.
I think Henry Mayo did a wonderful job, and they always, heeded my request to keep those patients who I knew at home would have difficult trouble at home, and they would keep them in their last moments of life. And that is an empathetic hospital where the Holy Cross and Henry Mayo have Dr. Kilani, who's out there doing exactly what needs to be done, taking care of people in this life so they can move to the next life. And, you guys do a wonderful job. Not an easy task either. Not an easy task, but kudos to you guys. I mean, we're so lucky in our community to have access to two hospitals that do their job and help us get through life get us home, get us the quality of life we need, or take us into the end of life. So, thank you for everything you do. I mean, I think about you all the time, Marwa, about the job that you've had to do this past year. And, I think about my colleagues working hard and difficult hours and seeing a lot of things that, the public doesn't get to see. But I see them doing what they've been trained to do as healthcare professionals and honoring our profession for doing that. So thank you so much, Dr. Kilani, for being on the show today.
Thank you so much.
It always makes our day and our hour go by very quickly.
Yes, we have such a good conversation. Thank you so much.
And it's so good to see you.
It is
just
great to
face
see
to
you.
face.
Yeah.
You don't know what you're missing, Dr. Dorio.
Well, we're missing the end of the show if I don't hurry. So we are sponsored by Comfort Keepers In-Home Care, Santa Clarita Hearing Center, Traditions Home and Hospice Care. Listen to us next week on the Senior Hour. Now go and enhance your quality of life.